big changes happening in America. Good evening, I'm Susie Hunter.
And I'm Ben Wilcox. Thanks for joining us on this Friday, March 26th. That's right, on Tuesday, President Obama signed health care reform into law, which will make major changes to the entire health care system. But what does this mean for college students? STN reporter Katz has the answers.
Well, I think that Obama's new plan for health care that just got passed is a great thing for our country.
My opinion on healthcare is that it's a big mistake.
I think that the healthcare idea is great.
Students, like the rest of the population, have mixed reviews for President Obama's healthcare bill. This bill, designed to rework the healthcare system, has specific provisions in it for different age groups. Aaron Smith from Young Invincibles talks about the provisions for students.
One of the biggest provisions that starts pretty quickly is the dependent coverage expansion. So that's going to allow young adults around the country to stay on their parents' plan until their 26th birthday.
Currently, in many states, at the age of 21, many students are no longer covered by their parents. This bill extends that coverage by 5 years.
I mean, there's too many people right now that can't afford health care that are uncovered, and I think it's just a great step in the right direction.
Another thing is, right now, a lot of student health plans have things called benefit caps. So what that means is that if you get really sick, oftentimes your student health plan will have a $50,000 benefit cap, meaning they won't spend the insurance company won't spend any more money above that.
In the new bill, limits have been placed on these caps, ensuring that students who get sick continue to receive full coverage. Even with these new provisions, some insurance companies want the bill to go further. Aetna issued a statement which says, "The challenge unmet by this bill, however, is how to effectively deal with the critical issue of affordability," and wants to go further. Some students also had some concerns.
I don't think I want the government to run, healthcare services, because I think it's well run as a private organization.
It'll be a good in favor for those that have nothing, but for those of us that do make money, it's going to charge us a lot more than we can actually afford.
In the big picture, I think it's better for the country, and I'm excited to see the change.
Katz, STN Channel 2 News.
Both chambers passed a reconciliation or fixes bill, which will be heading to the president's desk for a signature. With this new bill, some of the provisions will not go into effect for 4 to 8 years, allowing time to recuperate revenue. President Obama was the first president in over 30 years to accomplish sweeping health care reform.
And as President Obama signed the health care reform bill into law on Tuesday in the majestic East Room of the White House, Vice President Joe Biden expressed his opinion for the bill in a less majestic manner. Biden was caught using the F word into a microphone while he was expressing how important the bill was. The White House did not make any statements on the matter.
If you were a student who really enjoyed a class that you took when you were a freshman, then you may consider becoming a preceptor. Preceptors help out the freshmen and teachers in those subjects